Story 1. I was a provider in a rural area urgent care. A man and woman came in complaining of bug bites. They were covered in open sores. They denied drug use in their social history. I asked, "Do you use illicit drugs?" They denied it. Okay, my approach changed. I said, "Listen, I don't call the police on people who use. Can we start over?" They said, "Meth. You don't say." Story 2. A paramedic responded to a man unresponsive on the street. The man had pinpoint pupils with a syringe hanging out of his arm. Administration of naloxone woke him up immediately. He exclaimed, "I do not do drugs." Story 3. Sir, your blood alcohol level would kill a normal man, and I can smell it from across the department. Also, you fell over twice while trying to stand up. Story 4. You can see she wrote doses on my drug sheet: 600 milligrams of methadone and 100 milligrams of diazepam a day. The heroin abuser and hospital regular shouted at me. I looked at the drug card and saw where the pharmacist had written it down in standard green pen, except for the last zero of each dose, which was written in a slightly different shade of green pen. Bravo, sir. Story 5. Worked for a drug research clinic. We told participants a blood test would be performed. If any illegal drugs were present, they would be detected. Do not waste your time. If you have used drugs, come back in a week and be clean. No penalty, no judgment. You just need to be free of drugs for 1 week. A full 75% claimed no drugs, yet the test results showed otherwise. Story 6. My roommate from college works some hours in the emergency room, and people still come in all the time claiming they slipped and fell on an object. I would think in 2025 this would be a thing of the past. You can order butt plugs online and have them shipped directly to you with no one knowing. There is no reason to keep inserting household items when there are many products specifically designed for that purpose. Story 7. I am a nurse, and I had a patient who claimed he had seizures. When he was having a seizure, I said, "I don't know what to give him to stop it." And the patient replied, "Fentanyl," while shaking. Story 8. I have been following my diabetes treatment plan. Sir, your toes are falling off and your hemoglobin A1C level is 14. Story 9. Not my case, but my mother's. We work together, we are both dentists. She starts extracting a tooth of an elderly lady after thoroughly reviewing her medications and any chronic conditions. She asks if the patient takes any anticoagulants that prevent blood clotting. No, she does not. Any aspirin? No aspirin. My mother extracts the tooth, but the wound will not stop bleeding. She asks again specifically about anticoagulants. No. After 30 more minutes and an x-ray to check for root fragments left in the socket, the patient, now distressed that the bleeding will not stop, says something like, "Maybe I should not have taken anticoagulant brand name this morning, and that is how I learned to suture wounds." Story 10. Not sure if this counts, but while taking a new patient's history back in 2011, he told me he was in a band. I told him I was a musician as well. He got excited and started to talk more about the others in his band. They were none other than the Beatles. He spoke of all of them in the present tense too. It was a sobering moment. I never would have known he was schizophrenic if I had not asked him about his hobbies. Not up until that point anyway. Story 11. I cannot take over-the-counter painkillers because they make my eyes change color. Story 12. I am GI. I was at the pub having lunch, and next to me was a guy 5 or 6 pints deep. I vouched for a sour ale he seemed unsure about. He ordered it and was still drinking it when I shook his hand and left. In the afternoon, I walked into my exam room and that guy was sitting there. Me. "Oh, hey, chief. I met you at the pub earlier." Patient. "Wasn't me." Me. "I told you the sour ale was great. You ordered it." Patient. "Wasn't me. I found it odd but skimmed the chart a bit, as sometimes we don't get to do it beforehand, and quickly figured out why he was lying. He was referred to our hepatologist for evaluation and management of his alcoholic cirrhosis. The office had scheduled him with me accidentally. He had indicated to the rooming nurse that he was sober for 6 months. I apologized for the scheduling mix-up but warned him that it was pointless to lie about his alcohol intake. He still lied at his rescheduled appointment with the correct provider. Oh well, it's his liver, not mine. Story 13. I was hanging curtains without clothes and slipped off the ladder, falling backward onto a candlestick. Story 14. Patient with endocarditis had a peripherally inserted central catheter line. Found in the bathroom with an empty syringe and a fentanyl bag. Room searched and multiple syringes and fentanyl bags were found. Patient started crying. Why would my boyfriend bring this in? He knows I don't use it. I didn't use it. Story 15. The doctors I work with ask if patients are taking their medication. They say yes, but once they are under anesthesia, the doctor says, they never filled the prescription. Story 16. Not a doctor, but a medical assistant. My blood pressure isn't normally that high. My patient is panicking after seeing the numbers and insists that the high blood pressure is abnormal and very concerning. I don't see any filled blood pressure medication prescriptions on their chart. I run the machine again, take a manual blood pressure reading, involve the nurse, and start checking thoroughly for symptoms of a hypertensive crisis. We involve the doctor in case the patient needs to be admitted. 15 minutes later, the patient says, well, I guess I haven't taken my blood pressure medication at all in the past week. Could that be affecting it? They believed that being prescribed the medication would immediately lower their blood pressure, even before they started taking it. I have started asking about medications right away to prevent panic when the blood pressure reads high, as it almost always does in our clinic. Story 17. No, but I work in information technology in a hospital. I had a ticket to replace a keyboard in the emergency room and was reprimanded by a doctor for response time. I was actually as prompt as possible. While I was working, I overheard the same doctor making small talk, boasting about this and that, when a nurse entered and explained some test results for a patient. The results showed that the patient was not lying about being sober and actually had some concerning findings. The doctor laughed and said he assumed the patient was lying and drunk because they appeared sloppy. This was said not in a humorous way, but in a demeaning manner. All I could think about was how much I hated that. If I were that patient, I would hope the doctor would believe me when I said I didn't drink, but that my seeming drunkenness was a worrying symptom. Scared me a bit. Story 18. I had a patient with lymphoma who came in not feeling well. His liver enzymes were severely elevated, he looked extremely ill, he was tachycardic, and his blood pressures were very borderline. He kept insisting he felt fine and would be fine going home. We spent all day on the phone coordinating with oncology and infectious disease. The concern was that his lymphoma had transformed into a more aggressive type. Overnight, his blood pressure dropped significantly, and he was admitted to the intensive care unit. His overnight lactate level was 12. He refused to let the overnight resident call his family because he was fine. He died the next day. Very sad case. If a doctor asks to call your loved ones because they are worried about how sick you are, believe them. Story 19. Me. Do you smoke? Patient. No. Me. But you are left-handed, yes? Patient. How did you know that? Me, you have tar stains on the fingers of your left hand. Story 20. I'm not a doctor, but a friend of mine works in an emergency room in Mormonville, Utah. According to his stories, many men who identify as completely heterosexual sometimes walk through their kitchen without pants, slip accidentally, and fall onto cucumbers that have lubricant on them. It's unusual. I'm not sure how these cucumber accidents keep happening to men who identify as straight and have families. Jokes aside, there is nothing wrong with being gay or bisexual, and nothing wrong with being a straight man who enjoys using toys for anal play. Please use items designed for anal use. Cucumbers are not meant to be inserted in any hole other than your mouth. Story 21. I am a medical laboratory scientist. I am the person who handles all the materials your mother told you never to touch. One day, a labor and delivery patient arrives and decides to have her baby. She had no prenatal care. The nurse draws her blood and sends it to the laboratory. I perform a blood type and Rh factor test. We do this on all patients because laboratory staff are cautious. The patient tests as a positive. However, her history in the computer shows B positive. I send the phlebotomist to redraw her blood because laboratory staff are cautious. Still a positive. I review the history and see that 2 years previously, I was the one who typed her as B positive. This time, I draw her blood again and inform the nurses there is a blood bank discrepancy. I call the physician. We cannot give her type-specific blood if she needs it. We will have to give her O-negative blood and start an investigation. Blood types do not change except in very rare circumstances. As I am retyping her results for the third time, still a positive, the nurse calls me, laughing. Our patient was admitted under her sister's name. She had stolen her sister's Medicaid card instead of obtaining one of her own. She did not want her parents to know she was pregnant. Story 22. I am a nurse, not a doctor, but I once popped my head out from behind a wall and startled a man who was clearly trying to pump hand sanitizer into a cup of water I had given him 5 minutes prior. In his state of panic, he instead pumped hand cream into it because he mixed up the dispensers. Then he told me he was just looking for some more water. Sure, buddy. Story 23. I have experienced a lot of pain that has landed me in the emergency room. I have been treated poorly at times. It is surprising when I tell medical staff that intravenous Toradol normally helps a lot if I have not had it recently. Toradol is a non-narcotic medication. I have never felt any mental effects other than relief from it. It works as an instant anti-inflammatory and significantly eases the pain. I have had doctors accuse me of drug seeking and refuse to give me anything, then change to agreeing when I mention Toradol. Story 24. A Spanish-speaking patient tested positive for methamphetamine on his urine drug screen. When I questioned him about it using a translator, the patient asked me whether it was some sort of multivitamin. Story 25. I have never smoked in my life. Are you sure they smoked a cigarette literally 10 minutes before you arrived? They smell like an ashtray and have very bad peripheral vascular disease. Story 26. Do you use cannabis or any other substances? No. Story 27. They always drink a lot of water, which they clearly do not. Story 28. Go work in the emergency room and you will realize that anything can be perceived in different ways if you are brave enough. Story 29. I am not a medical professional, but I imagine any healthcare provider who works in a clinic that treats sexually transmitted diseases has encountered many married men claiming to have contracted a sexually transmitted disease from a public restroom toilet seat. Story 30. I broke my toe and need pain medication. The patient walked into the clinic wearing heels. Story 31. I asked a 5-year-old how a bead got in his ear. He claimed he did not know. Story 32. A pregnant woman squatted on the floor in front of me, peed on the floor, stood up, and told me her amniotic fluid had just broken. No? You just peed on the floor? Story 33. Your skin is really dry today. I'm worried that is contributing to your itchy skin. What lotion do you use? Oh, I use this brand. I just did not put it on today. As I try not to breathe in the flakes of dry skin falling off my patient's legs. Seriously, everyone, regular lotion use will save your skin. I cannot tell you how many patients I see daily for an itchy rash on the legs due to dry skin. Story 34. I once lied to the paramedics because I really did not want to go to the hospital. They asked if my pupils are usually different sizes, and I said yes in the hope they would say, "Oh, never mind then, bye." Anyway, they absolutely did not believe me and took me in to be checked for a stroke. What I was actually having was a hemiplegic migraine. Story 35. As a dentist, someone said, "Doctor, I didn't brush this morning. I am sure it is not just this particular morning." Story 36. Not a doctor, but a former veterinary technician. The number of people who would swear to me that they do not use drugs and that there is no chance their dog could get them, while their dog is obviously impaired by marijuana. Well, we do have this potpourri that is marijuana-scented. Listen, first, no one wants a marijuana-scented air freshener. Second, I just need you to tell me what it was, so we can treat your pet. Third, maybe reduce your marijuana use so you stop leaving it where your dog and probably children have access to it. Story 37. Back when I was a medical student, I was on an emergency room rotation with an older man who came in claiming to have severe abdominal pain. Barely touching his stomach would send him into a screaming rage of pain. The attending physician asked him to stand up. He got out of bed and acted like he was in severe pain. The attending asked him to jump, so he started jumping up and down. Then the attending looked at me and asked, "Have you ever seen someone with an acute abdomen be able to jump?" This man was a known pain medication seeker. I'm sure I have more stories, but I immediately thought of that one. Story 38. I was just standing on the corner minding my own business when someone drove by and blew white powder in my face. That is why I tested positive for cocaine. Story 39. Can I chime in with a different perspective? I had just had a baby and was recovering in the hospital. When my baby cried, she would let out a really high-pitched scream. Throughout the day, random nurses and doctors came in asking if I smoked, drank alcohol while pregnant, or consumed too much coffee. They also asked how I was feeling and checked my vitals. Finally, a midwife came in, and it turned out she was the mother of my childhood friend. We had a chat. She cuddled my baby, heard her scream, looked at my chart, and laughed. She told me babies with such a high-pitched scream often suffer from withdrawal symptoms. They thought I was using something. Story 40. Dentist here. The man who owns the nail salon across the parking lot is my patient. Every 6 months, I ask him if he smokes cigarettes. Every visit, he denies it. Yet, every day I watch him from my office smoking a pack of cigarettes. Sometimes I wave. Story 41. My sibling is a doctor and told me about a time when a girl was very obviously faking seizures. When another doctor said she was faking it, she stopped mid-seizure and said, "No, I am not." Story 42. A cousin had an itch and thought it was right to put mouthwash in a syringe and introduce it into her vaginal opening. She then saw a doctor and explained that all her discomfort was okay but did not mention the mouthwash. She spent months in treatment because the doctor diagnosed a burn on her cervix, which worried her. After about 6 months, she confessed what she had done. The doctor then changed her treatment, and she improved within days. Nowadays, she tells the story and laughs because the doctor was more worried than she was. Story 43. Remember, children. Tell the police nothing. Tell the medical professionals everything. Story 44. He fell on a bushel of apples for the second time in 2 years. When the radiology department read the scan, they said the tumor had grown in the interim. We informed them it was an apple in the rectum. They asked how he swallowed it whole. I wish I were joking. Story 45. No abnormalities detected. I was a sonographer in a high-risk obstetrics office for years. I had a patient who was 28 weeks pregnant with poorly controlled type 2 diabetes and a history of noncompliance come in for a scan. I asked her if she had been tracking her blood sugars, and she enthusiastically told me yes and handed me her chart for the past month. All of the entries were written in the same pen, and the numbers were too consistent. She had clearly filled in the values for the entire month in one sitting. Story 46. Pharmacy technician here. I take that every day. Please, we haven't filled that prescription in 6 months, and it was a 1-month supply. Don't lie to your pharmacy. Trust me, most of us are not judging you. Concerned? Yes. Judging? No. It is your health. If you have a stroke because you haven't taken your blood pressure medication or lose a foot because of untreated diabetes, there is only so much I can do to help you. On the opposite end, regarding any controlled substance, I only take it as prescribed. I am out of it. You have gone through a 30-day supply in 20 days. No, it is too soon, and I am not filling it for cash. What you need to do is have an honest conversation with your doctor about how you have been taking it because clearly the treatment plan is not working. Story 47. Not a medical professional, but I assume the question, how often do you consume alcoholic beverages, is very important. Edit. I am referring to patients who are currently struggling with alcohol use disorder. Story 48. My dad told the doctor with a straight face that he loves walking and he walks daily despite actually being bedridden for the past few months. When he could actually stand, he just sits on the couch to watch television. I understand lying, but not something so blatantly untrue and easily verifiable. Story 49. My anesthesiologist sister routinely has patients claim to be allergic to every single narcotic except hydromorphone, or whatever the drug of choice is, but it is usually hydromorphone. They regret it, though. As she explains to them, it is extremely rare to be allergic to certain narcotics, so since the patient is already allergic to many of them, hydromorphone will probably cause them to go into anaphylaxis the very next time they take it. It is safest to avoid narcotics entirely. They will have to have their surgery managed with acetaminophen. For post-surgery pain control, acetaminophen. She will put a note in their charts and talk to their doctors about how they can never safely take any narcotics again, regardless of pain levels because of their allergies. The thing is, everything she is saying is true. If they are allergic to half a dozen narcotics, they cannot safely take any narcotics. Their clinic doctors, who they regularly ask for hydromorphone, usually respond to my sister with gratitude. Now they have a documented medical reason to say no every time without exception. Use acetaminophen. Do not lie about medication allergies, kids. Story 50. 90% of this thread consists of absurd lies, and 10% involves women with unusual symptoms who were not believed. This is actually helping me understand why healthcare is like that. Story 51. Not a doctor, but a nurse with more than 20 years of experience. If a person is lying to you, I accept it and remain unbothered because they are telling me what they want me to know about themselves. If there is a laboratory test or result I need to base my care on, I rely on that result to provide the information necessary to safely care for that person. If the result is the opposite of what a person is telling me, I recognize there may be deep shame, medical-based stigma, or a defense mechanism in place for the person receiving care. Medical settings are not safe spaces for everyone. Let people lie. They will do it anyway to protect themselves. It often reveals what you need to know, and there is never a reason to shame anyone seeking care. Story 52. My cousin is a doctor. He said a very obviously pregnant girl came in with her mom. She was 5 to 6 months along. When asked if she had ever had sexual contact, she said no. Her stomach looked like she was pregnant. Doctors have a list of questions they need to ask to be sure about the diagnosis, such as whether the patient is sexually active, to rule out other disorders and tumors. This is only funny because they sent her in for an ultrasound and saw a baby. Story 53. Me. Do you have high blood pressure? Patient. I do not have high blood pressure. Me. Do you take any medications? Patient. I am taking losartan, the lowest dose daily. My blood pressure is already low. Story 54. No abnormality detected. Me. Hello, sir. I am calling to cancel your upcoming elective surgery with us due to your current COVID-19 infection. Him. I do not have COVID-19, I am fine. I will keep the surgery date. Me. Let me look at this note in your chart. It looks like there was a televisit with your primary doctor this morning regarding your cough and positive COVID-19 test. Him. Story 55. Not a doctor, but I worked in life insurance for a while. We had an agent opening his own policy, and the requirements for the whole life insurance he wanted were a blood test and a medical exam. He completed everything, but when I declined him and his policy, he got upset and yelled via email that he does not do drugs. Well, the positive cocaine result on your blood test says otherwise. Story 56. I am not a doctor, but once a suspicious-looking lady approached me asking for a ride up a big hill for her dog. She already appeared very unwell and insisted that she was not on drugs. I feel like the only people who say they are not on drugs probably are. I did not know her intention for the ride up the hill with her dog, but we kept moving in the other direction because we did not want to find out. Story 57. I am a patient, not a medical professional, but I have a bad experience with a doctor who was dishonest. The doctor diagnosed me with inappropriate sinus tachycardia. When I asked what we would do about it, he said, "We don't need to do anything. You have a hormone imbalance that is causing this, and it will go away on its own over time." No blood work or urine tests had ever been done or ordered by the doctor since I started seeing them for the issue. I have a new cardiologist who is excellent. This was the only doctor who blatantly lied to me. I have been dismissed by doctors before or encountered doctors in bad moods, but I have never been lied to like this. No ill will toward doctors in general, just this one. Story 58. A child came in nearly dead from diabetic ketoacidosis. and one of the parents said they had run out of his insulin 24 hours before. Later, the other parent confessed they had not given their child insulin in over a week. Story 59. I am an occupational therapist, and one of my clinical rotations was inpatient psychiatry. I participated in grand rounds every Wednesday with our psychiatrist, resident, and third-year medical students. We had a patient who would wait outside the door of our meeting room, and the minute the door cracked open, he would throw himself down and violently start seizing. We got so used to it, as it happened every Wednesday, that all of us would politely step over him and say things like, "Hi, Kurt. Nice day. Kurt, you are not getting any more clonazepam today, and you might want to stop that, buddy. It is probably going to make you sore." After we had all stepped over him and returned to our respective duties, he would calmly pick himself up off the floor and act like nothing had happened. Typical psychiatric ward behavior, I was told, but as a student, it was very bizarre and eye-opening. Story 60. I was the liar. I had a terrible kidney infection and kidney stone at the same time. I was delirious with pain and fever, but did not have any health insurance because I had recently been cut off by my parents. Somehow, it seemed like a good idea to use her information to access her insurance when registering for emergency care. I was 15 but tried very hard to convince the doctor that I was 45. They treated me and I was okay in a few days, but I could never go back knowing that they knew I was telling the worst lies. Story 61. I am a dietitian, not a doctor. I had a patient who I saw as an outpatient for recurrent vomiting, who kept presenting to the emergency department several times a day. I took a history and summarized. So you were saying you have been vomiting 12 times per day for 5 days, and estimate each time you vomit it is equal to about 1 cup. You have not kept any food or fluid down during this time, and you are still producing 1.5 to 2 liters of urine a day. They said yes. I followed up with, so you have basically been having close to 5 liters of fluid per day, yet you have gained 2 kilograms and are not showing any clinical signs of dehydration? They went completely silent for a while. After some more probing, it turned out they had a very difficult social situation and were trying to get admitted to the ward to get away from it all, which was very sad. Story 62. Of course I eat healthy. Of course I exercise regularly. But I certainly followed her instructions. I consume alcohol only very rarely. Everyone should be in the top 5. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.